Hi everyone, welcome back to our physiotherapy and gerontology. And today we will discuss lesson 3, physiology of aging. So just to recap, the previous topic we have learned about the theories of aging that may have a lot of relationship with the current topic. And we have also learned the model of service delivery. Okay, for introductions, aging begins at conceptions and continues for as long as we live. Aging is gradual and spontaneous change resulting in maturations through childhood, puberty, and young adulthood, and then decline through middle and late age. Aging is not reversible. Aging involves regressions of physiological function accompanied by advancements of age. The change from maturity through senescence, which is sometimes we relate as the negative impact or aging process, the progressive accumulation of changes with time associated with or responsible for the ever-increasing susceptibility to disease and death which accompany age with advancing age, all of the body system eventually demonstrate reduced efficiency, slow building and replacement, and actual loss of tissue. So after completing this lesson, you should be able to define aging, define senescence. You should be able to describe and explain the changes in majority of the physiological systems of the body. And you should try to compare the physiological changes related to aging process in the young and in the old persons. So these are the contents of this lecture. Right, so these are the concepts that I want you to go back and try to understand and explain these concepts. Okay, aging, right? So aging, A-G-I-A-G-E is just about the spelling. Okay, we'll ask you in the uh, next seminar what it means or why is it different in terms of the spelling. Okay. Alright, so senescence. Okay, what is senescence? Physiological aging versus normal physiological changes versus physiological decline. So you must be able to differentiate, in in uh, uh, in older people or aging related to physiology. Is it normal or is it because of the other factors like poor lifestyle, disease that will accelerate the process of aging. Okay, so there are some terminologies that you also need to know that in fact, it actually uh, try to indicate that the changes is the changes are actually accompanying aging, which you don't really find it in the younger people. Right, so now is activity 1. Okay, you try to discuss, compare and contrast aging versus senescence. Alright, so you try to look at this YouTube. Okay, so to get further understanding of aging versus senescence. Right, so what happened to our physiological system um, from tomb to from womb to tomb, okay, from conceptions to maturity until we die. Right, so you can see that the hair will change. Okay, in men, they lost their hair about their around the temples. Hairline recedes or male pattern baldness may occur. Increased hair growth in ears, nostrils, and on eyebrows. Loss of body hair. In women, okay, usually they don't normally develop bald, but they still experience receding hairline. Okay, the hair become less and less. the hair becomes thinner. They increase hair growth about the chin and around the lips. Loss of body hair as well. Body hair as well as the men. Okay. They have changes in the toenails. It becomes thicker and more difficult to cut. Okay. They grow more slowly and they may have a yellowish color. Okay. You have changes in the skin. They have changes in the skin because of the number of epidermal cells decreases by 10% per decade, and they divide more slowly, making the skin less able to repair itself quickly. The epidermal cells become thinner, making the skin look noticeably thinner. Changes in the epidermis allow more fluid to escape the skin. The ridges of the dermal epidermal junctions flatten out, making the skin more fragile and making it easier for the skin to shear. This process also decreases the amount of nutrients available to the epidermis by decreasing the surface area in contact with the dermis, and slow repair and turnover. Alright? So changes in the dermis will cause the skin to wrinkle and sag. You can see the dermal layer thins. There will be less collagen produced. Elastin fibers that provide elasticity also wear out. There will be reduced function of sebaceous and sweat glands that contribute to dry skin. Okay, changes in the subcutaneous cause the fat cells get smaller. Alright, this leads to more noticeable wrinkles and sagging. So what happened to the body composition and stature? Right, so body composition here is referring to uh, muscle mass, bone mass. All right, so bones will undergo a lifelong process of remodeling. Mature bone tissue is removed and the new bone tissue is formed. Okay, bone remodeling is highly regulated process that maintains a balance between bone resorption and formation, thus maintaining skeletal integrity. This balance changes with increasing age, resulting in loss of bone tissue. Okay, so the aging bone has reduced mineral content and is prone to osteoporosis, a condition in which bones are less dense, more fragile, and prone to fractures. So let's look at what are the changes in the bones and the joints. There will be gradual loss, again, loss of bone mass, okay, where bone resorption is more than bone formation. Okay, so now uh, formations of bone is less, okay, and there will be more resorptions of bone mass, okay. So normally we start at probably at the age of 30s, okay, but in women it will be even faster when they have their menopause, okay. So osteoporosis is a common problem among older people, okay, especially postmenopausal women, and it's a major cause of hip fractures in the elderly. Reduced bone density of the vertebrae combined with the loss of fluid in the intervertebral disc results in a curved and shortened trunk. This reduced bone density and resulting poor posture leads to pain, reduced mobility, and other musculoskeletal problems. What happened to the joints? Okay, there will be a decrease in water content in cartilage. The wear and tear theory regarding cartilage destructions and activity does not hold up, as osteoarthritis is also frequently seen in sedentary elders. Okay, so it's basically partly due to aging. Okay, so decreased water in the cartilage of the intervertebral disc results in a reduction in compressibility and flexibility. This may be one reason for loss of height. Joint motions becomes more restricted and flexibility decreases with age because of changes in tendons and ligaments. As the cushioning cartilage begins to break down from a lifetime of use, joints become inflamed and arthritic. So now, activity 2. Discuss the prevention. All right, so here are some of the points for discussions. Exercise is important for preserving bone density. However, care must be taken to avoid high impact exercises and exercises that present the risk of falling. Useful exercises include weight-bearing exercises, example walking, strengthening exercises using free weights, elastic bands, balance exercises, for example Tai Chi, a healthy diet including adequate dosage of vitamin D and calcium is also useful for preserving bone mass. So hopefully that you will have a healthy bones, right? So the second discussion is on exercise and aging. Exercise is wonderful for health, but to get gain without pain, you must do it wisely using restraint and judgment every step of the way. Here are a few tips. Get a medical checkup before you begin a moderate to vigorous exercise program, particularly if you are older than 40, if you have medical problems, or if you have not exercised previously. Okay, so these are some of the recommendation. Okay, but of course, all recommendation by physiotherapists need to be supported by research evidence. So what happened to the muscles? Okay, so sarcopenia, which is a generalized muscle weakness, is actually a muscle disease, is primarily due to aging. All right, so the characteristics of sarcopenia include reduced muscle mass, reduced muscle strength, and reduced physical performance. Okay, so some of this muscle wasting is due to diminished growth hormone production, but exactly how much is due to aging versus disuse is unclear. Okay, sarcopenia is associated with increased fatigue and risk of falling that compromise ADL. Sarcopenia affects all muscles, including, for example, the respiratory muscle, which actually can lead to reduced efficiency of breathing and GI tract that can cause constipations. Okay, so you can see here the picture. These pictures in aged muscles and probably in a healthy adults. They have a bigger bulk of the muscles. All right. And also one of the theories that you as you get older you become inactive. Okay, it actually affects the mitochondria. Okay, so you can see that yeah, the mitochondria probably will reduce in size and reduce in numbers. Okay, so what are the changes to the respiratory system? Okay, changes in the lungs. The number of cilia and the level of activity is reduced. The glandular cells in large airways are reduced. There will be decreased number of nerve endings in the larynx. The cough reflex is blunted, thus decreasing the effectiveness of cough. Will be decreased levels of secretory IgA in the nose and the lungs, and this will decrease the ability to neutralize viruses. The number of alveoli do not change significantly. The number of functional alveoli decreases as the alveolar walls become thin. The alveoli enlarge are less elastic. Okay, but they are even though they don't really the numbers of alveoli in the lungs remain, but their function is actually less. For example, they are less elastics, therefore probably it affect the expansions of the lungs. Changes in the lung, again we continue. There will be decreased elasticity of the lungs that could be due to cross-linking of the collagen. The loss of elasticity accounts for senile hyperinflation. Unlike in smokers, there is little or no destructions of the alveoli. The FEV1 drops by 30 ml per year during adult life. Okay, vital capacity is diminished by about 20%. Residual volume increases by about 50%. Okay, so you have residual volume in your lungs. Okay, the air that remains in the lung. Combined less function alveoli with slightly thickened capillaries will lead to decreased surface area available for oxygen carbon dioxide exchange. So lower oxygen supply to vital organs, especially in setting of acute respiratory illness. That is why you know that older people who infected with COVID-19, okay, they are very high risk of mortality because the respiratory function is badly affected. Okay, the respiratory muscle lose strength and endurance. This is increased. There is increased stiffness of the chest wall. Okay, decreased compliance, and that further lead to a reduced lung expansion. Okay, so pulmonary vasculature becomes less elastic. The artery thickens and enlarges. Then it will lead to increased resistance to blood flow in the lungs and increase pulmonary artery pressure. Okay, again, now we continue with the cardiovascular system. What happened to the cardiovascular system? Because there will be structural changes with aging that affect the myocardium, the muscles of the heart, the cardiac conduction system, and the endocardium. There is a progressive degeneration of the cardiac structures with aging, including a loss of elasticity, fibrotic changes in the valves of the heart, and infiltration with amyloid. The age-associated structural characteristics that have the greatest impact involve the contractility of the heart's left ventricular wall. The pumping capacity of the heart is reduced with age due to a variety of changes affecting the structure and functions of the heart muscles. For decades, it was thought that the heart undergoes atrophy with advancing age, but evidence suggests that an age-related increase in the left ventricular posterior wall thickness of approximately 25% has been found between the second and the seventh decade. An increase in the heart mass with aging, for the most part, is due to an increase in the average myocyte size, whereas the number of myocardial cells declines. So there will be a deposits of the aging pigment, which is known as the lipofuscin in the heart. Okay, the valves of the heart thicken becomes stiffer. The number of pacemaker cells decrease, and fatty tissues and fibrous tissue increase about the sinoatrial node. These changes may result in lowering the heart rate. Okay, so there will be a slight increase in the size of the heart, especially the left ventricle, which is common. The heart wall thickens, so the amount of blood that the chamber can hold may actually decrease. Okay, so the heart may feel more slowly. To compensate, elderly demonstrate doubling of percent atrial contributions to filling. Right? So under normal circumstances, the heart continues to adequately supply all parts of the body. However, an aging heart may be slightly less able to tolerate increased workloads. Okay, for example, of stresses that like illness, infections, emotional stress, injuries, and extreme physical exertion. So in older people, if they are exposed to these kinds of stressors, they may not be able to tolerate, then they probably will this may lead to heart failure. So what happened to the vessels? So the arteries thicken and stiffen in the media of large artery uh, is is thought to be caused by collagen cross-linking. All right. So remember one of the theories, cross-linkage theory of aging. All right. Smaller arteries may thicken or stiffen minimally. Their ability to dilate and constrict diminishes significantly. In the veins, age-related changes are minimal and do not impede normal functioning. The aorta becomes thicker, okay, the largest artery in the body, the aorta become thicker, stiffer, and less flexible. This may lead to blood pressure, increased blood pressure, resulting in left ventricular hypertrophy. So there will be increased large artery stiffness causes a fall in diastolic blood pressure associated with a continual rise in systolic blood pressure. Higher systolic blood pressure, if left untreated, may accelerate large artery stiffness and thus perpetuate a vicious cycle. So baroreceptors normally function is to stabilize BP during any movement or activity, become less sensitive with aging. This may contribute to the relatively common finding of orthostatic hypotension, right? So in the blood, okay, hematological changes, there will be a decrease in total body water, okay. Blood volume therefore decreases. The number of red blood cells, okay, are reduced. But of course, it is not significant, all right, unless it is also associated with a certain disease. Most of the white blood cells stay at the same levels, but lymphocytes decrease in number and effectiveness. That's why we always relate aging normally is accompanied with reduced immunity because it's partly the functions of the white blood cells. So overall, cell counts and parameters in the peripheral blood are not significantly different from the young adult life. So what happened to the endocrine system? Because the endocrine system is so complex and interrelated, it is difficult to discern the effects of aging on specific glands. Okay, so there are many glands in the body. They are very complicated. The pathways are complicated. In most glands, there is some atrophy and the decreased secretions with age. Okay, but the clinical implication of this are not known. Some are actually known. Okay, um, okay, so the major functions of the endocrine system, of course, it produces hormones that regulates our body, major functions in the body, all right? But you know that hormones are gender dependent, okay? So you have some hormones only can be found in women, not found in men or the other way around. And this is actually, especially in women, is affected by age. Okay, right? So these are important functions of the hormones. Okay, glucose homeostasis, the reproductive functions, calcium metabolism. Okay, and those that found in the hormones produced in the thyroid, okay, in the adrenal, Alright, so what happened to the neurosensory? Okay, there is neuronal loss in the brain through life. Okay, in terms of amount and location, the loss may vary. Okay, loss is chiefly gray matter, not white matter. There is some evidence that although some neuronal loss occurs with age, many neurons have increased dendrite growth, which may at least or partially compensate for neuronal loss in some areas of the brain. So there will be a slowed neuronal transmission, okay, because of the also changes in the neurons. Okay, changes in sleep cycle, takes longer to fall asleep. No, total time spent sleeping is less than their younger years. Awakenings throughout the night, increase in frequency of daytime naps. Okay, sense of smell markedly decrease. The lens of the eye loses fluid and becomes less flexible, making it more difficult to focus at the near range. And also they also may suffer from dry eyes. What happened to the kidney? Okay, renal blood vessels become smaller and thicker, reducing renal blood flow. You can see here the picture. Okay, the older one is shrinking. Decreased renal blood flow from about 600 ml per min. That may begin at the age of 40 to about 300 milliliter per minute by the age of 80. Okay, so it's half gone. Kidney size also decreases. There will be decreased GFR. Okay, there is a decline in the number of renal tubular cells, and increase in tubular diverticular and thickening of the tubular walls, leading to decreased ability to concentrate urine and clear drugs from the body. Alright, so overall, the kidney function, however, remains normal unless there is excessive stress on the system. What happened to the bladder? The muscular ureters, urethra and bladder lose tone and elasticity. The bladder may retain tone and elasticity causes incomplete emptying. So there will be a decline in bladder capacity from about 500 to 600 ml to about 250 ml. So there will be less urine that can be stored in the bladder. That causes more frequent urination. The warning period between the urge and actual urination is shortened, so or lost as one's uh, ages. Okay, so that is why you uh, oftenly you see older people you with incontinence. Okay, what happened to the immune system? The efficiency of the immune system declines with age, but this is it varies among the person. So non-specific defenses becomes less effective. The ability of the body to make antibodies also diminish. Okay, autoimmune disorder are increased in older adults, but not everyone believes that the incidence of autoimmune disease is an expected part of aging, but all acknowledge the increase in findings of positive rheumatoid factor, anti-nuclear antibody, and false positive syphilis screens in healthy older adults. Okay, so these are some of the autoimmune diseases. The thymus gland, which produces hormones that activate T cells, atrophies throughout life. So the peripheral T cells proliferate much less exuberantly in old age, and the common infections are often more severe with slower recovery and decreased chances of developing adequate immunity. All these changes may actually increase the risk of premature mortality. Okay, now, okay, watch the YouTube. Uh, you need to search or write the aging changes of the following. Okay, reproductive system, the liver, the gastrointestinal So, as a conclusion, clearly elders are at disadvantage when it comes to generating metabolic heat. They have less muscle mass and therefore less generating apparatus. They have less alveolar surface, therefore less oxidative reserve. Their skin provides less protection from heat loss. They have impaired neurotransmission, therefore less ability or desire to initiate activity. All of these factors put the elderly at risk for hypothermia if the environmental circumstances expose them to heat loss greater than their resting heat generating capacity. Normal aging changes are universal. They are changes that everyone will get to some degree as they grow older. So it means that we are all the same. We will undergo majority of these changes. So gray hair is a good example of normal aging changes. These normal changes do not cause diseases or disability. Okay, so aging of the hair, changing color of the hair uh, does not cause disease or disability. It's just that the look of it, you see people with white hair, you know that they are old. Okay, so let's do the review questions. Okay, now you are able to define aging, senescence, normal aging. Okay, and then some of the terminologies that you commonly found that is only used among older people. Okay, you don't use sarcopenia to indicate muscle weakness or muscle degenerations in young people. Degeneration of muscle in young people, okay, weakness of muscles in young people, it could be due to secondary sarcopenia. Okay, you don't call people, young people, if they have mental problem, that they are senile, but you use senile, you commonly use senile for older people. Okay, so you should be able to compare the aging changes in young and older persons, explain why there are changes in the physiological systems once we reach a certain age, identify all the physiological system in the body that is subjected to changes, okay, find evidence to support the occurrence when of the changes. Okay, so again, here's some of the review questions. Can aging process be stopped, delayed, slowed down? Okay, discuss your opinion. As a physiotherapist, do you have any roles in delaying or slowing down aging process? Discuss ageism. Give examples to your discussions in relation to physiology of aging. Discuss those changes that are considered norms for being an older person. Is there any practices such as diet, exercise, spiritual activities, or lifestyle that has been shown based on empirical studies to slow down aging process? How do you feel when someone predicted your age to be older than what you're supposed to be? Okay, so if you recap, aging changes will occur to most of the systems in the body, but not all. There are some functions of the physiological system that remain the same as older young people, or their functions. Okay, so we should be able to, at the end of this lecture, okay, you try to discuss which physiological functions that remain as those when they were young. All right, so that's all. Thank you very much.